Good morning, afternoon. Shit, I lost it. Right there. All right, good morning, good afternoon, everybody. Have some special lighting over there in the top right corner of the screen. It's like studio lighting. It's like a glamour shot at the mall. I'm not sure if they still have that. Everybody's coming in. Let me make sure there's nobody here. Luckily for you guys who's cramped in the at the CSCLV, this is going to be a short one. I'm just going to cover, what is this? The Synthroid, thyroid medications. There's only two things, to bring it up or to bring it down. Simple. There's going to be a couple of questions on it, on the test, and that should be it. And you will probably figure that out, which ones are going to be on the test, because I'll probably say it over and over because you see it in the hospital. All right, let's start. Can you guys hear me? Thumbs up? Yes, good. Make sure nobody's trying to get in. Short and sweet, because I got to do a Costco run for the game tonight. I need to restock. All right, lights, camera, action. I got to get on my script. We all, hold on, I got to turn off my fan. Forgot the vacuum was running. All right, back. We know that thyroid hormone is responsible for increasing the metabolism by increasing oxygen consumption in the body, in every cell of our body. This controls almost every single cell of our body and how we function, live, breathe. And there's a couple of medications that we take, patients take, that you guys need to know. And we'll talk about that. So when I'm talking about thyroid and parathyroid glands, it has 3 hormones: T4, T3, calcitonin. Some of you may be on this thing, maybe your parents, your grandparents. If so, talk to them about it. Ask them, what is this thing? How does it work? And how does it make you feel? It is like a miracle drug for especially the elderly. I just learned this the other day. There is a World Thyroid Day that's being celebrated on May 25th, every May 25th, to bring, to spread the information. I don't know how it works. We don't talk about this in the hospital. So let's talk about the T4, T3, and then the calcitonin. T4, T3, they're product of the thyroid glands. So this is how it works. The iodine that's found in the diet. So these hormones, these thyroid hormones, remove iodine from the blood, concentrates it, and prepares it for attachment to tyrosine, which is an amino acid. And we'll skip that part. So this thyroid, it has 4, maybe 5 functions. And this is the first one: growth and development. Oops, growth and development. Next one is metabolism. Next, heat production and body temperature. We're starting to talk about my vital signs now. Temperature, O2 consumption, cardiac output, and blood volume. Now you're starting to talk about my heart. Temperature, heart, blood pressure, overall vital signs, and respirations. The next is it affects the enzyme that metabolizes the carbs, fats, and proteins. So how it absorbs these nutrients in our bodies. It's also critical for brain and skeletal development and maturation. So what are the goals of thyroid therapy or treatment? It's pretty simple. It's to bring you back to normal, bring you back and bring the person back in a euthyroid state, meaning having a normal thyroid function, which is going to give you a normal metabolism and normal bodily function. And I'm talking about bodily function from blood pressure to pooping to peeing to breathing, simple things that we take for granted before and after thyroid. So since this is a simple session, we only have two types. I gave you a down payment on this earlier. It's either your thyroid is low or it's too much. And we have medications for both of these. And that's what we're gonna talk about. First is the hypothyroidism. Number one cause of hypothyroidism is Hashimoto's thyroiditis, which is an inflammation of the thyroid gland. There is no cure and only symptom management for these people, for these patients. Sometimes too, when it gets so bad, the surgeon will remove somebody's thyroid. And of course, that's going to cause a hypothyroidism because you don't have thyroids anymore. Other ones, lack of sufficient iodine in the diet causes hypothyroid. That's why they added salt in iodine in our salt. I don't even know how many years ago. It's always had salt as far as I remember. And also lack of sufficient functioning of the thyroid tissue due to tumor or autoimmune disorders. So this is when there's some tumor there, and this is before surgical removal, when they're trying some medications to hopefully get this thyroid to function properly, even when there's a tumor there. Let's talk about these drugs. So the thyroid replacement therapy restores normal concentration of thyroid hormones for hypothyroidism, cretinism, myxedema, 3 indications for the thyroid drugs. And we're going to talk about these right now. Oops, not yet. So these are most of the commonly used medications for hypothyroidism: Levothyroxine, Synthroid, and thyroid desiccating, Levothyroxine, blah 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 blah. I have not seen any of the lower third of this list. The main medication you will see in a hospital setting, in the family setting, if you're on it, is either Levothyroxine or Synthroid. Levothyroxine is the generic brand, and Synthroid is the, what happened to Sadie? Synthroid is the brand name. It might be on the test. Actually, it will be. How does it work? Same with any other medications, absorbed in the GI tract, because it's a PO medication. If it's not absorbed in the GI tract, then why give it PO? Give it IV, which we can with these medications. It does not cross the placenta. So this one is safe for the pregnant women. Contraindications for this medication, as always with any other medications, known allergies. Next is thyrotoxicosis, which is another word for hyperthyroidism. Because why are we going to give somebody medications for hyperthyroidism if if it's going to increase their I meant that the other way. You know what I meant. Acute MI, because it also has an effect on the heart, on the cardiac output. We don't use this for cardiac purposes for blood pressure control, hypotension, hypertension, but it has a direct impact on the cardiac cells. Caution for lactating women and hypoadrenal conditions such as Addison's. Why? Well, it'll come up here in a few minutes. Nursing considerations for these thyroid medications. First two are standard. The next is Addison's disease, acute myocardial infarction, and thyrotoxicosis. Everything else is standard, but with this thyroid medications, what you need to know, if you're administering this medication, treat it like a beta blocker. Remember, with the beta blocker, you need to know your patient's blood pressure and heart rate. Same with this. I don't need to know the blood pressure. Actually, I do. I need to know the blood pressure and the heart rate. Unlike the beta blockers, where it's required in some facilities that you take an apical pulse before you administer the medication. With these, you just need to know what the pulse and blood pressure is before you can administer it, because it has a great effect on the heart. You do not need to take this, the pulse and blood pressure minutes before you administer this medication. You can, if the CNA took the vitals 30 minutes ago, an hour ago, just grab the list, get the vitals from her or him and look at it. If the vitals are normal, administer it. If your patient is tachycardic, hypertensive, you may need to hold this administering this medication. You may need to call the provider and see if there's anything else we can do, because your patient might be exhibiting an overdose on this medication. Adverse effect. Cardiac stimulation, which is why you need the heart rate and blood pressure before you administer this medication. There's 3 stars by it. It's kind of important. Next is this medication is contraindicated for heart medications such as digitalis, anticoagulants, breathing medications, theophylline, because if you guys forgot, theophylline also increases heart rate. And here we have medications that stimulates the cardiac. So it's not a good combination for the patient. And most of the time when the patient is on a thyroid medicine, they're working with the cardiologist. Cardiology and endo, they're working hand in hand to optimize the dosage for this patient, for your patient. Things to know about levothyroxine or Synthroid. It's a synthetic form of T4, usually in the hospital setting or at home. Patients take this first thing in the morning as soon as they wake up. They take it alone. They don't mix it with any other medications. They take it before breakfast and wait before they eat their breakfast or take any other medications. They check their pulse rate, because I told you that already. And if a patient is started on this medication, they need to know that they're not going to feel good right away. It's not going to start working until 4 to 6 weeks from now. Doses range between 50 to 200 mics per day. And stick with the formulation. What does that mean? That means, where's my no? Nope, nope, nope. That means if I have a patient, if I'm on this hypothyroid medication called Synthroid, I've been taking this medication for the past 10 years and I'm happy with it. I feel good. I feel great. This is working for me. And when you get to the hospital, when I get to the hospital, the pharmacy does not carry my specific brand Synthroid. Most of the time, the hospital only has the generic brand, which is Levothyroxine. My patient on the screen is saying, no, I don't want your generic brand. It's not that I am brand, what do you call that? I'm a brand snob, because there's a slight difference between the generic levothyroxine and the Synthroid brand, specific brand. And with these types of medications, a small difference, a small change can make a big difference on the patient. And most of the time, your patients have already tried the levothyroxine medication, and it did not work with them. So what are you going to do if your patient says, "Here you go, Mrs. Jones. Here's your thyroid levothyroxine, 7 a.m. Take it." What are you going to do if the patient says, "No, I don't want your generic brand. That doesn't work on me. That causes my, I don't know, let's say blood pressure to go up, gives me heart palpitations. I feel like crap. I don't want your generic brand." What are you going to do? What you're going to do is say, "That's quite all right. You don't have to take my generic brand." And 99.9% of the time, these patients on Synthroid, they always carry it with them, especially when they go to the hospital. They carry it with them in their purse, and they'll ask you, "Sonny, honey, is it okay if I take my Synthroid that's in my purse? It's the same dosage, it's the same medications, but I would just prefer to take my Synthroid brand." The answer is, yes, you can. Take your medicine, ma'am, and have a good day. Depending on the facility, most facilities would want to take the Synthroid brand medicine from them and take it to the pharmacy, and they'll dispense it. And when it's time for the patient to go home, whatever they don't use, they'll give it back to the patient to go home. We just don't like patients having their own medications at the bedside. It doesn't matter if it's Synthroid, Percocet, Lortab, Valium, Ativan. It's all the same. It's not. Next is cretinism. Cretinism. This is a congenital disease acquired from birth. It starts within 6 weeks of birth, and their thyroid levels are so low that this is what happens to them. It's a congenital issue. And so what do we do for these patients? We put them on a thyroid medications for life. And it is important to tell the family member and the parents that your baby is going to have to be on this thing for life, or mental retardation may result if you stop it. So what happens when I take Synthroid or levothyroxine? I keep saying Synthroid because it is what most people take. So if I'm saying Synthroid, I meant levothyroxine, and vice versa. So what does it do to me? If I'm feeling like crap because my thyroids are off, hormones are off, and I start taking this 4 to 6 weeks later, this is what's going to happen. Energy, activity level are going to increase. Alertness, my appetite is going to get better. Pulse rate and temperature are going to start getting regulated. My constipation is going to decrease or go away. Cholesterol is going to get better. And reversal of hair and skin problems. This is like a miracle drug if you're a 50 to 60, well, maybe even 40, well, whatever, however old you are, you're old person. It's going to take care of all these things simply by taking this one little pill every morning before breakfast. It sounds like a miracle drug. Not so much, because it also has side effects. It has side effects. One is tachycardia. Remember, this has an effect on the heart, palpitations, and other cardiac arrhythmia. I already told you guys, cardiologists are working with endocrinologists so they can get the proper dosage for this medications. Angina, MI, CHF, cardiac. You need a cardiologist before you get on this thing. Nervousness, tremors, hyperactivity, insomnia. What else? That's part one of adverse effect. Diarrhea, cramping, nausea, vomiting. Pretty much, I'm starting to feel like crap again. It's not working out. That means you're either giving me too much of this, not enough, and you need, or the provider needs to get me to my right dosage. Because if I'm still experiencing these adverse effects, then it's kind of pointless. Why even take it? It's waste. I think even the Synthroid brand, which is what most patients prefer, I think there's a higher copay for that. And these people are okay to pay that. Oh, the last one, intolerance to heat. Very important to these patients taking Synthroid or Levothyroxine. And so one patient education for them would be, do not even think about going outside right now. It is 125 degrees outside. You will probably pass out as soon as you walk out the door. So stay indoors. So labs, if my thyroid are well regulated, everything will be normal. However, if it's not, this is what's going to happen. My TSH is going to be up. T3 is going to be low. T4 is going to be low. Then I'm kind of back to square one. So that's why a lot of these patients, most of these patients on these thyroid medications are on frequent lab checks. Then they go see their physicians regularly for this reason. What do you need to tell? What do you need to know to educate my patient that's going to be on levothyroxine? Right here. Ma'am, Mrs. Jones, you need to take this medication every morning on an empty stomach. But why? I like having my breakfast. I gotta have my steak and eggs every morning, honey. Oh, no, ma'am. Because if you do, the absorption of this medication, the effectiveness will be decreased. Then you're not gonna feel better anymore. So no to breakfast. Eat your breakfast after you take the medicine, 30 minutes to an hour later. Okay. And also I take sometimes I take antacid, iron preparation, and caraphate for in the morning, and sucrafate. Ma'am, it is also no. It is a no to take these medications with this Synthroid or levothyroxine, because these medications will provide coating to your stomach lining, and again, it will decrease the effectiveness of this medication. If you have to take some of these medications, we recommend that you take the levothyroxine 2 hours before any of these. Next, timing. I already talked about this. Take this medicine first thing in the morning, 6:30, 7 o'clock in the morning. I don't know what your daily schedule is, but first thing in the morning before breakfast and any other medications. I mean, it's okay. What you're going to see in the hospital is Synthroid is normally on the MAR for 6:30 to 7 o'clock in the morning. But sometimes, I don't know, most of you guys have probably administered Synthroid or levothyroxine with the morning medication. That's not supposed to happen, but things happen in the hospital. This medication might be due at 7 o'clock in the morning, but my patient in bed 2 is coding right now. I have a rapid response next door. So your levothyroxine at 7 o'clock, Mrs. Jones, that can wait. I'm going to be in the code blue next door. So when I'm done with that, it's now 10 o'clock because I'm way behind from this code blue. All right, Mrs. Jones, I know this Synthroid is way behind schedule, and I'm also giving you with the rest of your medication, but I'm still going to give it to you. I know that it's not going to be as effective. It's probably going to throw you off, but it's better if I do it this way than just skip this dose and give you the next one in the morning. I just need to tell the night nurse, or if I'm coming back in the morning, I just need to make sure that when it's due next morning, I give it to you back on schedule. If you're on any of the Valley Health System hospital, sometimes we're administering medications and you're asking me, what's the reason? It's saying we're giving this thing behind. Remember, I always tell you guys to click the bottom one. It's wean to standard admin times. That's exactly what we're trying to do. Get it back on schedule because somebody got behind. You got behind. It's okay to do that. I talked about frequent labs already. We need to frequent lab checks on these patients. Another patient teaching for levothyroxine is the most important ones. Do not switch brands. Do not switch brands. If you try, they will yell at you. They will probably throw the bottle at you because they don't want your generic brand. If they don't have their brand name with them, the Synthroid, they're probably going to take your levothyroxine generic brand only because there's no other choice unless their husband or somebody brings their home medications to them. Other than that, they don't want it, and that's okay. Next is consult your provider if the patient is going to take some over-the-counter drugs that stimulate the heart or cause nervousness, like cold medicines, decongestants, or asthma. I'm not sure if they still have asthma over-the-counter inhalers, but just be careful with these. We try not to mix it with these medications. Next, coffee. Limit coffee intake. It's going to cause heart palpitations. You see, this medication is not going to work on me. I drink a lot of coffee. If they're drinking special coffee, that's okay, as long as it's in moderation. Every day is okay, maybe twice a day. Next, report chest pain. Mrs. Jones, if you're having some chest pains, I need to know. Palpitations, nervousness, insomnia. If these patients are in the hospital, they are more than likely on a cardiac monitor. Because of this, it is it can lead to a life-threatening illness if the adverse effect does not get under control. And also, this medication, levothyroxine, Synthroid, it's a lifelong treatment. Stopping it can cause mortality, a higher than normal mortality rate. Here's your drug card for levothyroxine. Not much to see there. Next, let's talk about hyperthyroidism, the opposite. I just talked about people with low thyroid. Now let's talk about people with high thyroid levels. This is what their thyroid is doing. It's producing excessive amounts of thyroid hormones, and it just keeps going and going and going. What's causing this? Graves' disease, probably caused by autoimmune and genetic disease. All right. People who have hyperthyroidism, these people, this lady, and these people. You know the difference between the first two ladies, Hillary and Oprah? they have theirs under control, but the others, they don't. I don't know why these, I can tell you what the person on the left, why she doesn't have it under control, because it looks like this picture was in the 1800s. So I'm not sure if they had this medication back then, but these two in the bottom, I don't know why it's not under control. I don't know, maybe they're from another country that doesn't have access to these medications, which is sad, but you can see the difference between having a controlled hyperthyroidism and not. And this is what happens to them. Increased body temperature, tachycardia, boom, 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 thick skin, palpitation, high blood pressure, low blood pressure. Look down the list, it's just not working out. Just imagine this person, my blood pressure is high, my blood pressure is low, my heart rate's up, my heart rate's low. That you just don't know what your body's going to do because of the hyperthyroidism. So what are the goals for these patients? Stop making thyroid. Prevent the formation of thyroid hormones. And we have some medications to give these patients so we can get everything back to normal, or at least as normal as possible, so we can relieve the symptoms. Symptoms from hypertension, palpitations, hot flashes, all those things. What is one is this? Thionamides, it's one of the antithyroid agents. Not much to see there. Partially inhibit the conversion of T4 to T3. Let's not focus on this one. Let's focus on the other one. Where is it? There. So one medication we see frequently for hyperthyroidism is this propyl, I cannot pronounce it, but you can say PTU. You will see that. And these iodine solutions, we don't really see these as much. Lugol solution, sodium iodide, not much there. So the Robles is back in. Okay. So PTU, that is one medication you need to remember for hyperthyroidism. What does it do? So these drugs may be used as the primary treatment or to decrease the blood levels of thyroid hormones before radioactive iodine therapy or surgery. So these drugs are given to produce a euthyroid state and to get the thyroid back to normal. We know it's not going to stay normal before surgery. And if you are in a patient in a surgical unit, this is what a patient with a thyroidectomy look like. They have a scar down here in the neck, and it's usually a 1 or 2 day surgery. It's not as bad as you think it is. So now next time you're looking at somebody and you see a scar on their neck, here's the thing. If you see a little dot like a zero, like a nickel or a dime, and maybe a penny, they may have had a tracheostomy at one point. If they had like a slit on their neck, that means they had their thyroid removed. Pharmacokinetics, same stuff with all the medications we've been talking about, well absorbed in the GI tract because it's a PO medicine. If you're having a hard time remember which ones are absorbed in the GI tract versus intravenously, if it's PO, it's GI tract, because we're not going to give it PO if it's not absorbed in the GI tract. And most of these medications are excreted in the urine or liver or poop. Adverse effect, thyroid suppression. That means we stop the thyroid production too much. We need to change the dosage to get it to the right level. The interactions with these antithyroid agents are oral anticoagulants, theophylline, breathing medicine, nurture metoprolol, propranolol, digitalis, heart medications, heart, breathing medications, and blood thinners. Another reason these patients are working with the cardiologist and the endocrinologist. Iodine solutions. For hyperthyroidism, it causes the thyroid cells to become oversaturated with iodine and stop producing thyroid hormones. That's it. That's all you need to know about that one. There's a standard dosage for this. PO 15 to 60 milligrams per day, or 15 to 15 milligrams per day if patient has liver issues. Let's skip that one. It's not important. Levothyroid for weight loss. Over the past few years, levothyroid has been used for weight loss. Definitely not FDA approved, definitely illegal. It is so bad that the FDA put a black box warning on thyroid medications to please do not use this medication for weight loss. What do they say? There's no evidence that thyroid preparations lead to weight loss, and larger doses are associated with life-threatening toxicity. Across the lifespan, children, if the children are on this thyroid medicine, they need to be monitored regularly, including growth records. Methimazole is the drug of choice for children with hyperthyroidism. Adults, they need to know that once you're on a thyroid medicine, you're on it for life. So these patients on thyroid medicines that have a higher copay, they kind of have to live with that. It's part of the being on this medication. And for the older adults, keep in mind that most older adults have multiple health issues, and the symptoms of hyper or hypothyroidism can be masked with their other diseases. So it is important for them to get their blood levels checked frequently and see their provider more than frequently. Let's skip that. Let's talk about the calcium regulations. Why do we need to regulate calcium? Because it affects muscle contraction and nerve conductions. There's 3 important hormones that regulate our calcium: vitamin D, parathyroid hormones, calcitonin. There's always a running joke in the hospital. If you talk to any of the Filipino nurses and tell them, hey, what's the calcium? What's your calcium levels? Your patient's calcium levels, and they'll tell you something else, because for some reason our tongue does not allow us to pronounce calcium properly. And just ask them and find out. So there's 2 types. You have biphosphonates and calcitonin. Let's talk about the first one, biphosphonates. They slow or block the bone reabsorption. And by doing this, they help to lower serum calcium levels. But they do not inhibit the normal bone formation and mineralization. So, so with this medication, their bone can get brittle. Adverse effect of the biphosphonate: headache, nausea, diarrhea, esophagitis, and bone pain. The Pagus disease, it's a disease of the bone which disrupts the body's normal bone recycling process. Here's a list of biphosphonate medications. I think one of the most commonly used here on the list is the Fosamax. There's also interaction with these biphosphonates, antacids, calcium products, iron, multiple vitamins, aspirin. And for the antacids and calcium products, it has something to do with the bone and also having that coating again in the stomach for absorption. What do we need to tell our patients when they're on biphosphonates? Take it on an empty stomach with the full glass of water, upright positions for 30 minutes, and observe and prevent for TMJ necrosis, esophageal irritation, femoral neck fracture. So you're probably thinking, what the? You're taking a pill and now I'm looking for neck fracture? TMJ necrosis? What's the deal with this medication? Because it has something to do with the calcium and the bone formation, reformation, so their bones are very brittle. That's why. This happens due to the lack of calcium in the bones. Calcitonin inhibits bone reabsorption, lowers serum calcium levels, and increases the excretion of phos, calcium, and sodium to the kidneys. Let's go to the side effects. Adverse effect of this medication is flushing of the face and the hand, which is kind of specific to this medication. And also the last one is a local inflammation at the site of injection, because this is a sub-Q shot that the patient takes, that the patient does themselves. It's like with the insulin people, some of them, or the heparin people, some of them might have bruised belly, arm from the many sub-Q shots. And these are two of the sub-Q anti-hypocalcemic agents, Forteo and Tapara. It's all right, you don't have to remember this. Biphosphonate, I'm not gonna. So that's all I got. I told you this is a quick and dirty section. It's hyperthyroid, hypothyroid. It's fairly straightforward. You either have low thyroid, high thyroid, and that's it. If I ask you something like this on the test, my patient has low thyroid, what do? Give him this patient medicine for the low thyroid. What if they have high thyroid? This is one of the fairly straightforward ones. On the next one, on the other hand, it's insulin. It kind of changes things a little bit. I have a lot on that because you have type 1, type 2, but so this is kind of like a freebie. Anything else? Question? Good. No questions? You lady in the pink. You did not shirt. You're wearing the same shirt from last week. I can't hear you, but I think you're acknowledging what I'm saying. Okay. All right, guys, if there's no questions, I will see you guys next week. I will see some of you on Thursdays and Friday. If you have not given me your midterm eval, it's probably late, and send it to me anyway. That's it. That's all I got. Didn't even get to finish my special coffee. All right. See you later.